Here is your question. Okay, so if you have read and understood, considering it critical care scenario, kindly tell me, how would you manage this patient?
Okay, I manage the patient according to advanced trauma life support protocol.
Good.
I will start by securing the airway. I will open the mouth and make sure, okay, ask patient if speaking it's okay. If not, I will make sure there is no frozen body in the mouth or anything, or the tongue closing the airway. And after securing the airway, and I will go for breathing and check for look for the chest if there is any chest like interstitial injury in the chest, and look for any using accessory muscles or anything in the respiratory, and give the patient high flow oxygen or non-breathing mask. I considering the patient have natural burn and burn in the trunk, and go for prophylactic intubation because
Okay.
maybe go for laryngeal edema, and
How would you
also
calculate the resuscitation fluid?
okay, I'll calculate it like
Yes.
2 ml multiplied by total body surface area by kilogram of the patient, and 2 ml, yeah, according to the area, and like
How
rule of
would you
9.
calculate the area? Is there any formula or criteria to determine how much or what is the degree of burn patient has?
Yeah, the rule of 9.
Okay.
We can use it like the arm like anteriorly 4.5 and posteriorly 4.5, also the face anteriorly 4.5, posteriorly 4.5, and the
How much?
trunk
Yes. What percentage of burn this patient has acquired? Calculated.
just 1 second. Face and
Quickly.
just 1 second.
You have to tell
I
me.
think 36 or 37.
You have to tell me what percentage. Okay, you told me 36. How would you describe? Is it the second degree burn, or is it the? How would you describe the depth of the burn this patient has acquired?
According to the sign, if it is like a blistering burn and previous blistering and edema and like redness area and painful, it will be a second degree.
Okay, can you
And
please tell me, this patient, you'll manage this patient where?
at the first few minutes, like in the ITU, and then referring the patient after stabilizing to a burn unit.
Okay, what is the criteria to admit the patient to burn unit?
If the patient have more than 10% burn from total body area, and if the patient have airway burn in the face, or in the sole or the palm of the hand. And if the patient have chemical or mechanical or burn by bariatric, like by physical burn, and if the patient have comorbidity or immunocompromised, and if the child above.
If the patient is a child, good. Okay, can you tell me, if you don't get to manage this patient on time, what are the complications you expect to see in this patient?
Airway compromised due to laryngeal edema, and also maybe have circumferential on the chest, like burn, lead to respiratory depression, and also compartment syndrome in the both leg could be
Okay.
happen.
Yes,
And
yes, that
uh,
can be one complication that can occur. Okay. Right. This patient is suffering from difficulty of breathing, and you suspect that patient has ARDS. And how would you manage this patient now? Or what is ARDS?
RDS, it is bilateral pulmonary infiltration
Okay.
with if BaO2 on ViO2 less than 26 26 kilopascal.
To confirm your
Or
suspicion, you do one imaging, and this is what it comes out. How would you interpret it? What are you looking at?
okay, there is bilateral pulmonary infiltration. Also, there is bat wing sign, and also there is curly B line. Or not? No, this is for pulmonary edema. This bilateral chest infiltration.
Pulmonary infiltration, yes, very good.
Yeah.
What type of respiratory failure occurs in case of
Type
burn?
1.
Okay, very
Type
good. Can you please tell me, okay, if it affects the renal system, there is sign of myoglobinuria. What is that? Can you explain? And how it happens?
Myoglobin, urea, like when the muscle broken and produce the product of the muscles in the bloodstream, like myoglobin, it is a protein of the muscles handling the oxygen. When it is this product will be in the bloodstream, it will be difficult to the kidney to excrete it, and lead to acute kidney injury, and also it is like rhabdomyolysis.
Okay, and also fluid retention, etc. Okay, this is the this. Would you consider this involvement of renal system as part of complication of ARDS or as part of the complication of burn?
It is part of complication of
ARDS.
burn and compartment syndrome.
Yes, and ARDS as well. Okay, what would
Also
be the
RTS.
last resort, the last alternative? If you like, I have tried all the measures and patient cannot be managed efficiently, what would be the last measurement or last alternative to manage this burn patient?
The question about the renal or about the burn?
This patient now has ARDS and going through all the complications, and you have tried all the possible alternatives in your hand. What would be the last that you?
Like ECMO,
Yes, very good. What is it? How do you do it?
extracorporeal something, then shock. It is like
How does it help the patient in coming back to the life?
yeah, okay.
If you would have to ventilate the patient, how would you do it?
Put the patient in low tidal volume.
Okay. Good.
To prevent a rupture of the alveoli, and also put the patient to prone position to
Yes.
enhance the movement of this um, secretion. And but I forget the BIP, how much the BIP, and what else?
What is Berlin's criteria?
Berlin's criteria, it is like criteria to determine the severity of RDS. We have 3 levels:
Yes.
mild, moderate, and severe. The
Yes.
severe is the ratio between BaO2 and FiO2 less than 100, and the moderate will be from 100 to 200, and the mild from 200 to 300, and the mortality rate will be like more than 45, I think, in the severe, more than 40 something in the severe,
Good.
and like 27 in the mild and 32 in the moderate. But and the severe, I forget it.
Thank you.